Welcome everyone. I'm excited to kick off our presentation today with episode 24. This is our very first slide, so I want to warmly welcome you all and thank you for being here. Today, we'll be exploring some fascinating insights that I believe you'll find engaging and informative. The title of our session is simply Episode 24, but we'll also be diving into some key topics that are sure to spark your interest. Over the course of this presentation, we'll cover the main highlights, important concepts, and practical takeaways. So, let's get started and enjoy the journey together. So, let's consider Miana, a 52-year-old patient with a fractured left tibia who's currently in a long leg cast and using crutches to get around. When caring for someone like Miana, it's crucial to monitor for signs of potential complications related to crutch walking. One key point here is that, while crutches are effective for mobility during recovery, they can sometimes lead to issues if not used properly or if complications develop. In this case, the question is, what should Nurse Joy be assessing for? We're looking for a sign or symptom that indicates a complication associated with crutch walking. Among the options, left leg discomfort is important to watch for. Discomfort could signal issues like pressure sores, improper fit, or circulation problems. Weak biceps brachii or triceps muscle spasm are less directly related to crutch walking complications. They're more about muscle fatigue or strain, but not specific complications of crutch use. Forearm weakness, on the other hand, might be a concern if there was nerve damage or overuse, but it's less typical as a primary complication in this context. So, the most significant sign to assess for is left leg discomfort, as it could point to pressure, circulation issues, or other complications that need prompt attention. Remember, the overall goal is to ensure safe mobility and prevent any setbacks during recovery. Let's focus on D, forearm weakness. When a patient presents with weakness in the forearm, it can indicate several underlying issues, often related to nerve or muscle problems. It's important to assess the distribution and severity of the weakness, as this can help us pinpoint the affected nerve or muscle group. For example, weakness in the flexors or extensors might suggest specific nerve involvement. Recognizing forearm weakness is crucial because it can be a key sign in diagnosing certain neurological conditions or injuries. Throughout this presentation, we'll see how identifying such specific weaknesses guides us toward the correct diagnosis and appropriate management. One common complication we see with improper crutch use is crutch palsy. This happens when there's pressure applied to the axilla or armpit area, which can actually compress the radial nerve. Now, this compression can lead to some noticeable effects. For example, you might notice weakness in the forearm, making it harder to perform certain movements. It also causes weak wrist and finger extension, which is often referred to as wrist drop. This is because the radial nerve is responsible for those specific functions, and when it's compressed, those muscles can't work properly. So, it's really important to use crutches correctly to avoid putting unnecessary pressure on that nerve and prevent these types of nerve injuries. Let's start with the left leg discomfort. This is actually expected in a patient with a fracture and a cast, rather than being a sign of a crutch complication. So, if the patient reports pain in the affected leg, it's usually due to the injury itself and the immobilization. Next, we have weak biceps brachii. Remember, the biceps muscle is innervated by the musculocutaneous nerve. So, weakness in this muscle can point us toward an issue with that nerve, but it's not typically associated with crutch nerve injuries. Then there's triceps muscle spasm. While muscle spasms can sometimes happen after trauma or nerve issues, spasm of the triceps isn't a typical sign of a crutch nerve injury. Usually, nerve injuries from crutch use don't directly cause muscle spasm in that way. Now, regarding why the other options are incorrect, these points help us narrow down our diagnosis. For example, pain in the leg aligns with the injury and cast, not nerve injury. Weak biceps points to musculocutaneous nerve involvement, but not necessarily crutch-related. And triceps spasm isn't a common presentation with nerve injury from crutches. Putting it all together, The key is understanding the typical signs and what points toward the actual injury versus complications from using crutches. When using crutches, it's really important to remember that they should support your weight on your hands, not in your armpits. This might seem like a small detail, but it's actually crucial for preventing nerve damage. If you rest your weight in the axilla, you risk compressing the nerves there, which can cause numbness, weakness, or even long-term nerve injury. So always ensure that your crutches are positioned correctly, supporting your weight through your hands and arms, with your armpits slightly clear of the crutches. This proper technique not only protects your nerves, but also helps you maintain better balance and reduces fatigue. It's a simple adjustment that can make a big difference in your recovery and overall safety. Remember, proper crutch use is a key part of safe mobility during your healing process.